Let us discuss the standards of community health nursing practice. Understanding the standards is a fundamental thing to your role as a future community health nurse. They serve as the framework guiding competent, ethical, and professional nursing practice in the community setting. Let us begin by examining what we mean by standards in this context. Standards are authoritative statements developed by professional nursing organizations and regulatory bodies. These statements are based on best practices and serve to guide how nurses should perform their duties. They describe a competent level of care or performance, meaning they outline the expectations for what a nurse should know and be able to do when serving individuals, families, and communities. Ultimately, standards serve as guidelines for quality practice, helping to establish consistency, promote accountability, and ensure that the care we provide is safe, effective, and culturally appropriate. Now, why are standards important? Now, they are because they help nurses evaluate their own practice. Standards serve as benchmarks against which nurses can assess their performance and identify areas for growth or improvement. This is crucial in a setting where independent and autonomous decision making is often required. Standards promote accountability. As licensed professionals, nurses are expected to justify the decisions and interventions they implement. Standards make this possible by providing an objective framework that defines professional conduct and care. These standards protect the public by setting performance expectations. They define what the community should expect from a nurse in terms of skills, ethics, and care, which fosters trust and ensures public safety. In the Philippines, standards are contextualized by our regulatory and government bodies. The Department of Health and the Professional Regulation Commission provide national guidelines that shape community health nursing practice. These standards are aligned with RA 9173. This law provides the legal foundation for nursing practice in the country, outlining the responsibilities, scope, and ethical conduct expected of every licensed Filipino nurse. Community health nursing standards are classified into two categories. First are the standards of practice. These are closely aligned with the steps of the nursing process: assessment, diagnosis, planning, implementation, and evaluation. They define what tasks and responsibilities nurses must fulfill in caring for a community. Second are the standards of professional performance. These refer to how nurses uphold professional values like maintaining ethics, pursuing continuing education, collaborating with health teams, and ensuring quality outcomes. These categories ensure that nurses are not only technically skilled but also ethically grounded and professionally competent. These standards guide core professional functions of the community health nurse. First core function is the health promotion and illness prevention. This involves empowering individuals and communities to make healthy choices and adapt preventive behaviors, such as advocating proper hygiene and conducting prenatal education. Another one is disease surveillance and control. This means monitoring and reporting health trends, identifying outbreaks early, and applying control measures, especially in vulnerable populations. Nurses also provide rehabilitative and palliative services, especially in GDAS or geographically isolated and disadvantaged areas, where they support patients with chronic conditions or terminal illnesses. Modern CHN standards are community-based, meaning they focus on what nurses can actually do in the field rather than just what they know theoretically. This approach is based on the Department of Health's Public Health Nurse Development Program, which outlines specific competencies that public health nurses are expected to demonstrate in real-world settings. These include providing safe and quality care, serving as advocates for the health rights of individuals and families, effectively collaborating with other sectors and community stakeholders, and using research to inform and improve health interventions. Community health nursing standards are applied through the nursing process, which ensures a systematic approach to care. In assessment, nurses collect data through household surveys, health interviews, and community mapping. In diagnosis, this data is analyzed to determine the health problems and priorities of the population. Planning involves identifying goals, selecting interventions, and allocating resources based on the family's or the community's needs. Implementation refers to the delivery of health programs such as deworming, immunization, or breastfeeding support. Finally, evaluation measures the outcomes and effectiveness of interventions, determining whether health goals were achieved and what improvements are needed. The development and application of CHN standards are influenced by both global and local forces. Globally, institutions like the World Health Organization set broad health priorities and guidelines, such as those on universal health care, equity, and primary health care. Locally, these are contextualized by Philippine health policies, such as the UHC Act, which aims to make health services accessible to all Filipinos. The integration of global frameworks into local settings ensures that our nursing standards remain both internationally aligned and culturally relevant. To summarize, standards in community health nursing are crucial for ensuring that our practice remains consistent, ethical, and high in quality. They are rooted in both global guidelines like those from WHO and Philippine laws such as RA 9173 and DOH policies. As benchmarks, they help nurses evaluate care outcomes, maintain professional accountability, and most importantly, ensure that the health needs of individuals and communities are met in a safe, evidence based, and culturally competent manner.